So why am I interested in the vagus nerve? Because that's how the body repairs itself, restores its physiology, reproduces, repairs. It's all done through the vagus nerve. So when your gut is so diseased, the vagus nerve dysfunctions because the vagus nerve supplies your gut. So the enteric nervous system, which is as big or maybe even bigger than your brain in terms of the neurons, they get affected because all those endings there in the gut are all inflamed and they're getting these messages from the leaky gut. They are so overwhelmed by your lymphoid tissues that are in your gut, and most of your immune system is in your gut. Now the enteric nervous system doesn't work very well. So your vagus nerve doesn't work very well. So what I tell patients is that your vagus nerve not working well is working against you. You need to get your vagus nerve working better. So you got to fix the gut. Then there's vagus exercises that I tell them to do. And I give them high doses of fish oil, which repairs the vagus nerve as well. And the vagus nerve exercises are very simple. And people say, oh, yes, there's Dr. J. He's telling the patients to breathe, prolonged expiration. Why is he doing all this? Oh, it's too much about meditation. No, it's not. It's evoking your body's own physiology. When you do the vagal exercises, your heart rate comes down, your blood pressure comes down, your platelets become less jittery. Oh, platelets again. Oh, excuse me? We already talked about how jittery your platelets are when you're going to get a heart attack, right? Right? So your platelets pacify. Have those tests all been done? Of course they've been done. Your mental state and your vagus nerve is going to determine whether your platelets are going to degranulate or not. How? Because the ends of your vagus nerve release acetylcholine. Acetylcholine then goes to all these mast cells and other cells in your body, including the platelets, and sets the level at which they will degranulate. Vagus nerve means it will take a lot for that platelet now to degranulate and clot. Those studies have been done. For example, I'll give a very quick study. This was done in Johns Hopkins, where they took the medical students and they put an arterial line in them. And they gave the test exam. And they were measuring platelet reactivity through a refractometer to see how easily they clot. And as they went through the pages, it was easy. The platelets were fine. There was nothing happening. Then all of a sudden, they got a page where they didn't know what the answers were because they were never taught that stuff. And suddenly their stress levels went up. And guess what happened to the platelets? They went crazy. I mean, we have so much. I can talk about these types of things about the mind-body connection and your emotions for hours, and maybe we'll do it one day. But basically, there's a big connection between your thoughts, your emotions, and your body's physiology. So in a detox program, in an anti-inflammatory lifestyle, you cannot omit mind-body medicine. You have to evoke that. And the vagal nerve is part of that because we know the vagus nerve has rostral connections to the forebrain as well. You cannot leave out sleep. I tell patients how to breathe, breathing exercises, breathe in, and how to go into silence. I teach them how to go into silence. That is anti-inflammatory. Because then you're not sending those messages to those platelets. So there is no message. You're in silence. The silence is mental, internal silence. So I teach my patients how to do that. I teach it to them for two reasons. One is that, and secondly, when they take their attention away from a thought and bring it back to their breathing, that ability to put their focus, their attention, their consciousness back here and bring it away from that thought gives them willpower. The gym exercises are different from the mind exercises. The mind exercises are your ability to focus where you want it to focus so that you don't get constantly bombarded with thoughts of the past or thoughts of the future. Instead, you control where you want your thoughts to be. And when you do that, stress levels go down. That's my approach to stress management. So that's another thing that I want to develop that in a much bigger way in my practice and everywhere else. That we are bombarded all the time, and we are obsessing about the future, and we regurgitating the past all the time, and we don't have the ability or the tool to get out of that. And I want to teach people this technique, because when you do that, now you put your attention where you want it to be, because you've been practicing to bring it back here to that feeling of the breath going in and out. So people say, Dr. J, this is not cardiology. No, it's fundamental cardiology. It is. It's fundamental cardiology, because it drastically reduces your sympathetic stimulation and you increase your parasympathetic. And I'll give you an example of where I use it the most here. Is I use it especially in young people who come in with tachycardia, rapid heart rate, palpitations all the time, fainting all the time. And I teach them these techniques, and they come back saying they feel so much better. They don't need ablation, SVT ablation. And so we use it a lot here in our office. So the breathing is important. Your ability to put your focus where you want it to be is an anti-inflammatory approach as well.
You have a number of videos giving exercises on your YouTube channel, which we'll link up. But let's give a few different exercises, somebody that wants to take this on for the vagus nerve. And how often would somebody want to do this?
Okay, I'll answer this last part first. So you just ran away from the tiger, the saber-toothed tiger. You just ran away. And it was a quick sprint. And this leads up to something about exercise. You did a quick sprint and you hid behind the rock. And as soon as the tiger went away, now you're just breathing normally. And your breathing pattern changes and you're doing prolonged expiration now. Just you're sighing and you're all comfortable and everything else. So how often should it happen? After each sympathetic burst. Today, our lifestyle is sympathetic all the time. It's go, 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 go all the time. So we're just not getting even time to sit down and evoke that parasympathetic response, that rest and relaxation response. So the answer to your question, the short answer, we should be doing it at least twice a day. And the studies do demonstrate that doing this type of inner silence twice a day for only 15 minutes in the morning and 15 minutes in the evening does translate to lowering blood pressure, lowering the heart rate. Are the studies being done for all the other parameters? No, I can't tell you that your interleukin-6 levels are going to come down because those studies have not been done. But I can tell you that it probably does help, but I don't have that data to support it right now. So the answer is at least twice a day. And in between, also, you should be consciously aware of your breathing, because we're always holding our breath instead of breathing out. And even when I'm driving, I make a conscious effort that I breathe in to the count of 4 and I breathe out to the count of 8. I do that consciously throughout the day. I do more prolonged expiration because the prolonged expiration stimulates my vagus nerve. Your heart rate variability, which is a marked predictor of cardiovascular survival, and the level at which you'll trigger arrhythmias, the heart rate variability improves. Heart rate variability is something you can do on your watch and see what your heart rate variability is. It's just that I think that technology is fantastic. It's just that people haven't been taught how useful it is, how powerful it is. And you can increase your heart rate variability by consciously looking at how you're breathing and do it throughout the day. 2 times you should be doing 15 minutes, total silence. You got to do that. And also, for those who have the worst problems, I tell them, first thing in the morning you wake up, splash your eyes with cold water. It evokes the diving reflex. My worst patients, I give them a little collar to wear, and it has a vagus nerve stimulator on it. So it just softly stimulates the vagus nerve. And a lady came to the office, and one of my assistants put it on her, and she like almost immediately felt so much better. But the point is that I can hack the vagus nerve. Then gargling is where I had a patient who was having arrhythmias, and in arrhythmias, SVT, she was having too much It's too much sympathetic, so you're getting a very rapid heart rate, SVT. And we do the Valsalva to break it, right? That's the breathing stuff that stimulates the vagus nerve. It didn't work. So she saw my video. So she took some water and gargled it. And every time she had SVT, it stopped. And she gargled it because you're also stimulating that. And humming is fantastic because when you hum, you do that. So singing, people should sing more. People should hum more. People should, the yoga postures that we do, those are amazing. And I'll tell you why I tell them to do that is because when you want to go into silence, you can't be aware of the pain in your ankle or your knees. So you need some degree of flexibility and your joints need to be good so that you can sit quietly and not be thinking about, oh my God, my back is hurting, my butt is hurting or whatever, So when you do these yoga exercises, they do help you to basically sit and be quiet with no bodily distraction. That's why I don't tell them you got to sit cross-legged. You just sit in your chair. You can do it on your couch. Just be comfortable, shut your eyes, and get into that silence. And it's all part of my anti-inflammatory pathways that I want to teach people. It's a comprehensive program. Yeah.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
A lot of coronary artery disease is very silent. That plaque is silently sitting there in millions of people without them even knowing. And there are ways to find this out now. We have the technology. It's just not